Maternal health here in Georgia is still a key issue for so many people. The maternal mortality rate here among the highest in the entire country, but there are groups still working to bring those numbers down. Joining us is Dr. Eboni January, board certified OBGYN, to talk about just the reality that we're seeing not just here in Georgia, but across the country for women giving birth, especially Black women who we know are disproportionately affected. Dr. January, thank you so much for being here.
Thank you for having me.
So I want to start off with a statistic that I pulled from the Centers for Disease Control and Prevention here, the CDC, based in Atlanta. It shows about 1 in 5 women report mistreatment during maternity care. Nearly half of all moms hold back from asking important questions. What are some of the most common forms of mistreatment that you have observed, and why do you think women are afraid to ask questions?
One of the things that I commonly see is just people feeling that patients don't know anything, so they feel as though they can just tell them whatever, right? They're not going to understand, so I can just, skim past this information and therefore not have an informed conversation with this particular patient. And so with that being said, now patients feel as though they're being rushed through their visits. They feel as though they don't have a say. But a lot of times it comes from lack of knowledge, not knowing how to advocate for yourself, not knowing what questions to ask because you don't know what complications may arise. We're just going, we're having the baby showers and the gender reveals, but we're not spending as much time on education and also interviewing doctors, interviewing hospitals as well. Like you have a choice, right? Here in Georgia, we have so many hospitals, so you have options, and we need to make sure that we're exercising those options and that we're opening up our brain to more and new information so that we can best advocate for ourselves.
In your opinion, just as a healthcare provider, and I've spoken to several doctors since I've been here on air, at least for 3 years, who, and I ask them the same question. I say, why is the maternal mortality rate so high here in Georgia? And I'd love to get your opinion on that.
So it has a lot to do with bias, right? A lot to do with racism as well, but preventable causes of death that we need to make sure that we're standardizing care, right? So in the state of California, for example, they have bundles. I'm licensed in 16 states, California being one of them. And when I do talks, I oftentimes utilize all of the resources, the toolkits they have in place because they have one of the lowest death rates, right? And so they are implementing toolkits, bundles, so that we can standardize care. But when we implement those things, we truly have to implement those, and they're not necessarily being implemented. There are no checks and balances, right? When you went through school, you studied, you had an exam, but sometimes you had a midterm. You were constantly being evaluated as to whether you had the information, and we're not, right? We're implementing these things, but no actions are really being taken. There are no checks and balances to make sure that the nurses and doctors are integrating these things into their practice.
So no board really kind of looking and making sure, okay, there's something wrong here. We need, and I know that Georgia had a maternal mortality review board at one point, but right now it's kind of in a little bit of limbo to see where that's going to go on. So are you saying it's an intersection between the medical providers and then those policy creators, those lawmakers? Where do you see
Not necessarily that, right? You have to, if you run any type of business, you need to know what's going on in your business. So we know that the death rate is there. We know when hospitals, they look at review boards of the cases that are happening, right? We know that we had higher infection, we have higher in this. So what is it that we need to implement to make sure that those numbers go down, right? So we toolkits, we do training, but it has to be continual. It has to be evaluated. If I'm in leadership, I have to make sure that my nurses and my doctors and other clinical staff are actually implementing these things. It's one thing to say that we have this protocol, but if it's not being followed, why do we have it in the first place? Right. So we have to make sure that we are evaluating whether these things, and also surveying. What was the hospital experience like? We have to take what patients are saying into consideration. We have a lot of people making decisions for us as Black women, right? But where is our voice? Where is the team approach? We have to make sure that doctors and patients are parts of a team. We need to know that the patient is a part of a team. I need feedback from you to make sure that you don't have something going on. Are you having headaches? Are you having spots in your vision? Those kind of things. I need to know those things. That means that you are a part of the team so that I can best do my job. But there has to be checks and balances to make sure that we are following the things that are working in other cities and states.
I want to ask you about checks and balances and accountability, but I want to center it around 2 high-profile cases that we've seen recently, one out of Indiana, one out of Dallas. The videos just going across social media. For those who are watching, just a refresher. In Indiana, there was a woman who was discharged from a hospital after she said she was experiencing pain. She ended up giving birth in her car just minutes later, 8 minutes later. Family claimed that she wasn't listened to. In Dallas, at the Dallas Regional Medical Center, a viral video showed a woman, black woman, in visible active labor and pain, asking for help. The hospital attendant continued to just ask her questions, almost ignoring her pain. Her family felt that this was a case of racial discrimination. So 2 cases, one in Indiana, one in Dallas. When you heard about these, what was your first reaction to that?
I had a few reactions. The first one, unfortunately, was I'm not surprised. As I stated before, I'm licensed in 16 states. I see a lot of people who get into the healthcare industry because it's a stable career, right? Not that they're passionate about something, but it's a stable career, right? So you lack empathy. You lack the ability to deliver culturally competent care, right? You're just, like you're stating, checking a box, getting someone admitted, but not showing empathy as if you're not a woman yourself, right? People pick and choose when they want to show empathy, or pick and choose when they want to put themselves in the shoes of the patient, right? Like, it's fine when you go into the hospital as a healthcare provider and you want preferential treatment, but it's not as different when you see a black woman who's in pain, who's in labor, and you're just typing away, not even showing any type of empathy. Both can exist. You can have empathy and do your job at the same time. And that was, so for me, the first response was, I was like, I'm not shocked because I've seen it, right? Secondly, I was pissed. I was pissed. The third reaction that I had was, finally is being exposed what is happening. And so now, hopefully, this is going to elicit change in the right direction to say, okay, if you are in a bad mood, if you are having a bad day, maybe we need to switch you out and put you someplace else. And not to say that you couldn't be a nurse or a doctor, but maybe we need to, be more transparent. Hey, I'm having a bad day, or can you put me here, not put me where we are actually admitting patients. You get what I'm saying here? So I see that often.
And you're talking about the healthcare attendant. Maybe they just weren't having a good day. Maybe they're not a horrible person. Maybe they just didn't want to deal with it. But in those moments, that can be life or death for somebody.
Absolutely.
So it doesn't matter what your mood is.
It doesn't matter your mood. You still have a job to do.
Yeah.
And so switch you out. Maybe as a person who is over this person, to say this person is being reported, or this person is not, in the best of moods, and we need to make sure that we understand that we have to save lives. And so we need to switch this person out, or they need to just go someplace else and do something else with their life, because it doesn't matter what mood you in, you have a job to do. I'm tired a lot. I've had to do surgery with the flu before. I've had to do surgery with a spinal issue, but I have a job to do, right? So it doesn't matter, like you stated, whether you have a bad day or not. You have a job to do, and no matter the situation, you have to show empathy. And unfortunately, we knew that these ladies were in active labor because they delivered shortly after.
That's right. That's right. When it comes to accountability, these cases did not happen in Georgia, but of course, cases like this could happen anywhere. When it comes to accountability, though, who is at fault and who should be accountable when it comes to something like this to make sure that what you're saying, that change is enacted?
Sure. The leaders, the hospital leaders have to make sure that things are not going like this, right? They have to make sure that they're evaluating the staff. What is the treatment of our patients? Right? This is also a customer service business, right? We have to make sure the hospital leaders we need to get out of the boardrooms and truly meet people where they are. We're making, once again, I said, we're making decisions for women, and we're not talking to these women. We have to survey as leaders to make sure that we're delivering the best care possible and that they're having a great experience.
Yeah. I want to ask you, because we are running out of time, unfortunately. I feel like I could talk to you for hours on this subject, but I know that you have spoken to women around the country about this exact thing. Can you leave us with those who have had children, those who still want to have kids, those who have experienced their own bad experiences, saying, I'm never going to let my daughter go to this hospital, right? What is some advice that you can leave us with as we're looking to do that?
Educate yourself. You have to educate yourself.
You can look at this camera.
You have to advocate from a place of knowledge. Many times we know everything about everything that's going on social media, but we don't know anything about our bodies. We don't know anything about the hospitals that we're delivering in. We don't know the patient advocate phone number. Get that before it's too late. The birthing place is not the time. That's not the time for us to figure out what's going on. You need to prepare yourself before you get into the labor room. Take tours of the hospitals, see the reviews online, educate, pick up a book, right? That's the main reason I wrote my book, was to make sure that patients could have educated conversations with their doctor so that things didn't go over their head. I can tell you what preeclampsia is, but then when I see you in the hospital, you have no idea that you have a history of preeclampsia because you didn't know what words that they were using. So educate yourself, empower yourself, and I want people to understand that maternal health is everyone's responsibility. It's not just on the mom. Moms are busy. They have other children, they have jobs, they have all of these things. So this is a team approach. We need doulas, we need midwives, we need significant others who are educated and knowledgeable. Don't leave the woman alone at this point. Like, there's so many things that we're going through during pregnancy that we need a team approach. And for doctors and midwives who there's a disconnect and doulas, we have to make sure that we understand that it should be collaboration over competition. We're one team, and the outcome is a healthy baby and a healthy mom.
That's right, that's right. And you did talk about your book, just the title of your book, if people want to come and read more.
Yeah, Empowered Motherhood, Essential Guide to Thriving During Pregnancy and Beyond. I wrote it, as I stated before, in response to my patients I was educating, and they said to me, Dr. January, nobody's educating us the way that you are. And I said, you know what? Let me give you a tool, tips. And you still need to have conversations with your doctor, right? Because things change over time. But it was really my response to them to say, hey, let me give you somewhat of my brain so that you can know what I'm talking about.
And you went to school for it. We are just grateful that you are here giving us a little slice of education. Dr. Eboni January, thank you so much for being here. We'll be putting more information, especially a link to the book as well, on 11alive.com, and just more information from the CDC and from our board here in Georgia, because hopefully together we can get these numbers lower.
We can. Thank you.
Thank you.